Have you ever wondered if every health checkup is truly necessary after a certain age? As we grow older, we're often encouraged to stay on top of our health with regular screenings and tests. It feels like the responsible thing to do. But what if some of these checkups, especially after 70p, may actually do more harm than good? Today, more doctors are beginning to speak up, raising thoughtful concerns about over-testing in older adults. The truth is, not all medical screenings are risk-free. Some can lead to false alarms, unnecessary stress, and even procedures that may carry serious risks. This video isn't here to scare you, it's here to inform you. With age comes wisdom, and one part of that wisdom is knowing when to ask, is this test really right for me? In the next few minutes, we'll take a closer look at common health checkups that may not be as helpful as they seem, and why a more thoughtful approach to care can lead to better peace of mind. So stay with us until the end. You might discover something that changes the way you think about your health journey. Let's talk about smarter choices, greater confidence, and the kind of senior wellness that truly supports the life you want to live. As we age, many of us continue health routines we followed for decades, trusting what once served us well. One of those routines is the colonoscopy, long regarded as the gold standard in preventing colon cancer. And indeed, for people in their 50s or 60s, it can be a life-saving tool. But after 70, especially if you're not experiencing any symptoms and don't have a family history of colon cancer, this screening may carry more risks than rewards. Let's take a closer look at why. The colonoscopy process itself is far from simple. It requires full bowel preparation, usually involving powerful laxatives that flush your system. For older adults, this prep can trigger significant dehydration and electrolyte imbalances, which are far more dangerous at this age. Even mild dehydration can lead to confusion, weakness, or lightheadedness, common precursors to serious falls. Then there's sedation. While many tolerate it well in younger years, an aging body processes these medications more slowly. That means lingering grogginess, mental fog, or even temporary confusion again, increasing the chance of accidents, especially at home afterward. Consider the story of Frank, a sharp and independent 82-year-old who hadn't had any digestive symptoms, but agreed to a routine colonoscopy after his physician suggested it just to be safe. During the prep, he became dizzy and disoriented. The procedure itself went smoothly, but later that evening, still feeling foggy, he lost his balance walking to the bathroom and fell, fracturing his hip. After weeks in rehab, Frank admitted the worst part: the colonoscopy found nothing at all. What many people don't realize is that polyps discovered during colonoscopies typically grow very slowly, often taking 10 to 15 years to become dangerous, if at all. For someone already in their 70s or 80s, the chances of a small polyp becoming cancerous in their remaining lifetime are often extremely low. Yet once something is found, the path forward can spiral quickly. Biopsies, follow-up procedures, even partial colon removals. It all adds up to emotional stress, physical strain, and financial cost for something that may never have posed a threat. Thankfully, there are less invasive and safer options available today. At-home stool-based tests like the fter, fecal immunochemical test, or Cologuard, offer a convenient and effective alternative for many. These require no sedation, no prep, and no recovery time. They're especially useful for those who aren't experiencing symptoms, but still want some peace of mind. In this season of life, thoughtful decisions can make all the difference. It's not about refusing care. It's about choosing the kind of care that respects your age, your body, and your quality of life. After all, wisdom isn't just about doing more. Sometimes, it's about knowing when less is enough. There's something reassuring about the idea of seeing everything inside your body with one scan. For many older adults, full-body CT or MRI scans feel like the ultimate way to catch something early. But once you're over 70, that sense of control may come at a greater cost than expected. The truth is, these scans are incredibly sensitive. They detect everything: small nodules, shadows, or spots that may never cause harm. But once something is found, even if it's benign, the worry begins. One incidental finding can lead to follow-up appointments, repeat imaging, or even invasive procedures like biopsies. And for seniors, those interventions come with much higher risks. A biopsy that might be routine for someone younger could lead to serious complications for someone older. We're talking about collapsed lungs, infections, or prolonged healing times, all from investigating something that might never have affected your health at all. Emotionally, the burden can be just as heavy. Seniors are often left grappling with fear over what-if scenarios, losing sleep over results that may never become relevant. Instead of bringing peace of mind, the scan can trigger anxiety that lingers for weeks or months. Let me tell you about someone we met at a senior wellness workshop. Her name was Margaret. She was 78, healthy, active, and feeling great. During a local health fair, she was offered a discounted full-body scan and thought, why not? The scan revealed a tiny spot on her kidney. It was so small that it hadn't caused any symptoms and likely never would. But the word lesion frightened her. Within a few weeks, she was in surgery. The recovery was slow and difficult. Months later, she still hadn't regained her energy. And here's another concern. Most of these scans aren't covered by Medicare or typical insurance plans unless there's a clear medical reason. That means many older adults are paying out of pocket, both financially and emotionally, for tests that may not provide meaningful answers. So what's a better approach? Trust your body. Pay attention to real changes like new pain, fatigue, or unexpected weight loss. Let your symptoms guide the conversation, not just a machine. Because sometimes, true health comes not from looking harder, but from listening more closely. It's only natural to want to take care of your heart, especially as you get older. After all, we've heard for decades that early detection saves lives. That's why cardiac stress tests, those treadmill or chemical tests that monitor how your heart responds under pressure, have become a routine part of many checkups. But once you're over 70, these tests may not be as helpful as they seem. You see, as the body ages, certain changes are expected. Arteries stiffen, blood pressure fluctuates, and heart rhythms may shift slightly, none of which necessarily indicate disease. But stress tests aren't built to distinguish between harmless age-related changes and real danger. They simply detect anything unusual, which can often result in false positives. Test results that suggest a heart problem when there isn't one. From there, things can escalate quickly. A result that raises concern might lead to additional testing, such as angiograms or catheterizations, and even stent placement or bypass surgery. While these procedures can be life-saving in the right context, they also carry serious risks for older adults, including bleeding, kidney damage, and prolonged recovery. We met a man named Harold, 74, during a senior community Q+A. He was active, walked every morning, had no chest pain, no shortness of breath. He felt good. But during a routine visit, his doctor suggested a stress test just to be safe. The results came back borderline, and within 3 weeks, Harold was in the hospital undergoing a cardiac procedure. Afterward, he developed an infection at the catheter site, which landed him in the ICU. Months of rehab followed, and the original test hadn't even been necessary. That's why many cardiology and geriatric experts now advise against routine cardiac stress tests for older adults who don't have symptoms. The evidence shows these tests don't lower heart attack risk or improve long-term outcomes for asymptomatic seniors. So what supports heart health after 75? The answer isn't more testing, it's a more grounded lifestyle. That means daily walks, balanced meals rich in fiber and healthy fats, staying socially connected, and managing stress levels through mindfulness or simply meaningful conversation. These small, steady habits nourish the heart in ways machines never can. Sometimes, the smartest thing we can do is listen closely, not just to our test results, but to our bodies, our energy, and our everyday experience. As we grow older, it's natural to keep doing what worked for us in the past. And for many, routine colonoscopies have long been part of that plan, especially after turning 50. But by the time we reach our 70s or 80s, the equation begins to change. What once offered protection may now carry more risk than benefit. One of the biggest concerns is anesthesia. Older adults process sedatives differently. The same dosage that was tolerated well at 55 might lead to confusion, memory problems, or mental fog at 75. In fact, a study published in JAMA Internal Medicine found that post-operative cognitive dysfunction is significantly more common in seniors after sedation-based procedures. Then there's the bowel preparation, often overlooked, yet extremely taxing. Drinking quarts of strong laxatives in a short period can cause dehydration and electrolyte imbalance, particularly in older adults with reduced kidney function. Many seniors have reported dizziness or weakness during the prep phase, and some even fall in the bathroom during the night, a surprisingly frequent emergency room cause among elderly patients. And here's something important that's rarely discussed. Most polyps grow very slowly, typically over 10 to 15 years. For someone in their late 70s or 80s with a history of clean screenings, the likelihood of a new polyp developing into cancer within their natural lifespan is often minimal. Still, the emotional weight of just to be safe can drive people into unnecessary risk. Take the case of Linda, a 78-year-old retired school counselor. She had clean colonoscopies at ages 60 and 70, yet her doctor recommended another, just in case. During the procedure, her colon was accidentally perforated, a rare but serious complication. She required emergency surgery, and after weeks in the hospital, never fully regained her strength or independence. This is why age matters. The balance between benefit and risk shifts over time. What was smart prevention at 50 might turn into avoidable harm at 75. Instead of repeating colonoscopies without symptoms, it may be more effective to pay close attention to real warning signs: unexplained weight loss, persistent abdominal pain, or blood in the stool. These are the indicators that call for immediate evaluation. Caring for your heart is one of the most important parts of aging well, so it's no surprise that many older adults agree to routine cardiac stress tests, even when they feel fine. The idea of catching something early is comforting, but after age 70, especially if you have no symptoms, these tests may quietly cause more harm than good. As we age, normal changes in the cardiovascular system become common. Arteries stiffen, heart rhythms shift slightly, and blood pressure may vary from one day to the next. These changes don't always signal heart disease, but the stress test, a treadmill or medication-based test designed to push the heart under strain, often misinterprets these normal shifts as something dangerous. This is where problems begin. A false positive test result can lead to a cascade of follow-ups, angiograms, catheterizations, or even stent placements, procedures that carry serious risks. According to research published in Circulation, complications in older adults after cardiac procedures are significantly higher. These include internal bleeding, stroke, and kidney damage, particularly in patients with pre-existing conditions. We met a gentleman named Robert, age 76. He had no chest pain, no shortness of breath. He walked every day and lived independently. At a routine physical, his doctor recommended a stress test just to be safe. The results showed a minor irregularity, which led to a catheterization. Doctors found a small, non-obstructive plaque and inserted a stent. Within a week, Robert developed internal bleeding from the blood thinners, ended up in the hospital, and spent nearly 3 months in recovery, all from a test he didn't need, for a condition that hadn't affected him at all. That's why more cardiologists now recommend symptom-based care over routine screening for older adults. If you're not experiencing signs like chest discomfort, shortness of breath during mild activity, or unexplained fatigue, the benefits of a stress test may not outweigh the risks. Instead, focus on tuning into your body's real signals. When something feels off, like pressure in the chest after a walk, or becoming winded with minimal exertion, that's when it's time to investigate. But if your days feel steady, your energy is strong, and you're enjoying your life, then let that be your guide. This shift in approach from automatic intervention to thoughtful observation can be one of the most empowering choices you make. It's not about giving up. It's about living smart, honoring your well-being, and preserving what truly matters: your time, your independence, and your peace of mind. There comes a time in life when the most important question we can ask is simple yet profound. Is this really meant for me? This question becomes especially relevant when it comes to healthcare. For many years, we've been taught to trust in more screenings, more tests, more procedures. But after a certain age, especially past 70, the real measure of care isn't how much you do, but how much it actually improves your quality of life. The truth is, not every test brings peace of mind. Some create the opposite: stress over uncertain results, fatigue from endless appointments, and fear about things that might never happen. It's a heavy emotional load to carry, especially when there are no clear symptoms or concerns to begin with. That's why learning to say no to unnecessary testing can be a sign of strength, not neglect. It's a conscious choice, an act of self-respect to protect your time, your energy, and your emotional well-being. It's not about avoiding healthcare. It's about making sure that what you choose truly supports the life you want to live. The next time a test is suggested, take a moment to pause and ask a simple but powerful question. Will this test change what we do? Or is it just routine? Having this conversation with your doctor isn't being difficult. It's being thoughtful. It's how we ensure that care remains personal, not automatic. In this season of life, the goal shifts. It's no longer about catching every possible risk. It's about living with clarity, not clutter. It's about feeling well enough to enjoy a walk, a meal, a good book, or time with people you love. So let's move gently, but with purpose. Let's keep asking, reflecting, and choosing with care, because growing older isn't about preparing endlessly for illness. It's about creating a life that feels meaningful, light, and deeply your own. As we grow older, choosing what truly supports our well-being becomes more important than ever. It's not about saying yes to everything. It's about honoring what feels right for your body, your energy, and your peace of mind. Starting tomorrow, take a small but intentional step toward better living. Ask questions, reflect, and when in doubt, talk with your doctor. You deserve care that fits you. Because senior wellness means living with clarity and purpose. That's the heart of senior living. If you're still watching and found this helpful, comment 0 or 1 below to let me know you're here. And if this message spoke to you, please like, share, and subscribe. Your support helps us keep going.